Hi, this is Dr. Shino Aguilera from Shino Derm, and today we're going to be revisiting the upper third of a male face. And we could see on our young patient Gabe is only 27 years old, and you can see that obviously he's not aging, but this is something that's really common in males. Women tend to dominate the upper third of the face, while the male tend to dominate the lower third. The mid third of the face has to do with genetics. Some races have very strong prominent cheekbones, like Asian, Native Indian, Polish, Russian, African descent, and this group of people tend to age in a slower pace because they have more bone in the mid third of the face. But today we're going to concentrate on the upper third, which is the area where females dominate. If you notice, females have arched brow, and males we tend to have lower brow. Females tend to have larger eyes, while males tend to have a lot smaller eyes. And the frontal concavity of males tend to be more pronounced. So females tend to dominate the upper third. And we could see in Gabe, if you can notice that there is a lack of soft tissue all throughout the area of the forehead, which causes the brow to be lower. And this is a genetic disadvantage, meaning that when he tends to get closer to the fourth decade, he probably starts noticing a premature aging of the upper face. So today what we're going to do, we're going to use Voluma to volumize the frontal concavity of the forehead. It's going to make him look a lot more useful. It's going to change the ratios and proportions of the forehead to one that is a lot more useful. And in terms, is going to allow him to age slower. Since aging is architectural changes, and we already have some deficiencies in the upper third due to lack of soft tissue, we're going to change the future of how Gabe is going to age. Not only is going to look more handsome, but it's going to stay more useful for the years to come. We'll see this technique in a few moments. So we have Gabe already set up for the procedure. We're going to use Voluma. We use Voluma diluted with 0.8 cc of 1% lidocaine. I try every single combination of different dilutions, and I find that 0.8 cc of Lido 1% is the best combination to create the best consistency to fill the frontal concavity of the forehead. The first thing we do when we do this procedure after mixing our product is trying to plan how we're going to fill this forehead. So the first thing we just try to find the temporal crest as a landmark, and we could see I created a line straight down on one side and a line straight down on the other. Then according to how wide or how deep the frontal concavity is, I set my points of entrance. Sometimes I can do it with one, sometimes we need to do it with 2 points of entrance. So I mark them with an X on each side. I will be using a 25 gauge cannula to enter in the areas that I will use a 21 gauge needle to create a little hole, and using a 25 2-inch cannula we will proceed to fill and alleviate the frontal concavity that Gabe has in his forehead. We also have a 5th X, which is to try to enter here and fill the middle should we need to go there. So that's it. These are the markings. You feel for the temporal crest on both sides. Plan where you want to enter. You could use it 1X, 2X, depending on what you see on the concavity, and one right here in the middle of the forehead, just to see if we need to go on this area and alleviate that depression as well. In a few minutes we will demonstrate the technique. But what I'm going to do first is use a little bit of lidocaine with epi on the areas of the exits, which is the areas of entrance. It's going to blanch, so I'm going to know where I need to go. But when I'm gonna enter with the cannula, I will remove all these points. And reason why is that we need to practice exact techniques. Also, this is pencil material, it could have paraffin, it could have other chemicals that if you introduce even a minute amount of this pencil material with the filler, that could be a bad recipe to get any infections or create granulomas. So I only mark for educational purposes. But when I'm going to do the procedures, these marks will be gone because I'm going to remove it and I'm going to use chlorhexidine sponge to make sure that everything is sterile. Okay? We'll be back in a few minutes.
Rolling.
Okay, so I already removed my markings and those areas is being already anesthetized with lidocaine with epi 1%. And I'm gonna proceed now to make a tiny little aperture with a 21 gauge needle. And then I will introduce my cannula. It's a really easy procedure. And we're gonna go on that subgallia space. I'm gonna inject a little bit just because the product has lidocaine. It has just 1% lidocaine, and I'm already there. Should not feel much, and I'm just injecting retrograde right there on the gallia. You can see how beautiful it plumps that up. So we have about close to 2 cc or 1.8 cc of product to play with. But the plan is to try to alleviate the temporal concavity and improve the look of the forehead. How you doing?
Good.
Not too bad, right?
No.
Perfect. Okay, so we just go, I'm gonna go a little more lower. And you can see if you check this side of the forehead versus the other side, we have a much better progression from here to there. You don't see that concavity, so it's looking quite phenomenal. Let's do the other side. Most patients with one syringe of Voluma will suffice, but there are patients with bigger heads or a bigger concavity, and you may need a lot more product. Okay, I'm gonna introduce a 21 gauge needle to make a tiny little hole. And you can see how comfortable the patient seems to be, so it's not very painful. But definitely take your time when you're getting close to the area where the supratrochlear nerve is. You just want to be gentle on that area. But my job is just to try to make the frontal concavity look less or correct the defect, improving the look of the forehead, preventing the premature aging of the forehead, preventing the early descent of the brow. Enter again. We need to enter on that space. Making sure that we alleviate the look of the concavity. It's looking amazing. Now I'm gonna go right in the middle part, and I need to go a little bit more back and down. I'm gonna make a tiny little hole in here, and I'm trying to alleviate this part in the middle. So let's go back and down a little bit, so I can position the patient better. That's pretty good. And then we'll proceed to make a tiny little incision there. Trying to bring the you're right in the middle. And that's it, you guys. This is how we alleviate frontal concavity of the forehead, allowing your patient to look more useful. It's an easy procedure. It really takes no more than 10 minutes. It took me a little longer just because I was explaining and demonstrating for the purposes, but the patient should not get very swollen with this technique, but you should warn it that there's a possibility of getting swollen inflammation. But unlike other products, with this combination tend to be less inflammation. Okay, this is Dr. Shino from Shino Derm demonstrating how to alleviate frontal concavity and make the upper third of the face to be stronger, more beautiful, and allow the patient to age better. Thank you very much.